Hello, my name is Autumn and I'm one of the respiratory therapists here at Pulmonary Rehab. Today our education is going to be based on medications and devices that you take with your respiratory disease. So I like to lead this education by saying that I know personally if I do not understand the why and how a medicine is helping me, then I'm not going to be compliant with it. So the goal of today's education is to explain to you why you're taking your medications and exactly what it's doing inside your lungs so that you know the importance of being compliant with your respiratory medicines. So managing your lung disease is the key to keeping your lungs and airways expanded and clear of blockage. So what I mean by that is if you are compliant with your respiratory medications, they are going to work how they're intended to work, and we're going to go over that in a second. So today we're going to talk about bronchodilators, steroids, and combination medications. So a combination medication is just a delivery device that has more than one medicines in it. So it might have 2 or 3. So I like this respiratory inhalers at a glance chart because it kind of shows you the different categories and you can see with your own eyes, if you don't know the name of your medicine, maybe you know the color. So you can kind of see what category it falls under and why it's important for you to take it pertaining to what category it falls under. You can also see that there's a bunch of different inhalers in the same category, which is nice to know in case you have an unpleasant side effect of one of your medications. The first category we're going to go over is bronchodilators. So that's a big word that means airway openers. So your bronchioles get very constricted. So your bronchioles are the tubes that run through your lungs. I like to kind of explain them as tunnels. So as you can see, the far right picture is a normal airway. So the tunnel that runs through your lungs, we want it to be very open so the air can move in and out very freely. So when you are having an exacerbation, inflammation, extra mucus, the first thing that's going to happen is the tunnels are going to be more constricted. So that means that air is going to have a more difficult time getting in and out of your airways. So a normal airway, as you see in the right-hand side, the left-hand side is going to be open. Air is going to flow in and out very nicely. And then the more constricted, the more inflamed, more mucus production, more angry airway is going to be more constricted. So what we want is for you to take your bronchodilator to keep it splinted open, to relax your smooth muscles in your airway, and to help your air move in and out more freely, easily. So the bronchodilators, as I said, it relaxes the muscles around the bronchial tubes to help air flow in and out of the lungs. So we have short-acting bronchodilators and long-acting bronchodilators. So your short-acting bronchodilators is kind of in the name of it. It's going to act very quickly. It's going to give you the relief you need, and that's why that is considered your rescue inhalers. So your rescue inhaler you should carry with you at all times and use it in case of chest tightening, in case of shortness of breath, you notice that or you feel more wheezing in your chest. That's when you would take your rescue inhaler, and that's why we want you to carry it with you at all times because it does give you that fast relief. It decreases your shortness of breath, it opens your airways and kind of gives you the relief that you need quickly. So it will act within 5 to 15 minutes and it lasts between 4 to 6 hours in your lungs until you no longer can feel the effect of it. So that's why you're usually prescribed 1 to 2 puffs every 4 to 6 hours. If you are very short of breath, I like to advise to go ahead and take both puffs. We're going to go into some different classes. I'm going to throw a couple big words at you, but I'm going to simplify it to the best of my ability. So with your bronchodilators, you have a beta agonist and an anticholinergic. So the way I like to describe those 2 words is first, they're very big words, okay? What you need to know about the different classes, about those 2, is that they are getting to different receptor sites. So say that you're sitting in your home. This is how I like to simplify it. Say you're in your house, you have a front door and you have a back door and you're sitting on the couch and you are sweating, but it's cold outside. So you kind of want to give yourself air to kind of cool you off. So you're going to open up the front door, let some air in. Well, for some people, that's enough to cool them off, okay, opening up that front door. For other people, maybe they need to open the back door as well. They need to make air flow through the back door and the front door at the same time to get them the relief, to cool them off. So that's what I like to describe as the beta agonists and the anticholinergic. They're the front door and back door medications. So sometimes they will prescribe you a front door medication for a bronchodilator, which is your albuterol, your lev-albuterol, your max air. And sometimes they will have to prescribe you a back door, which is your Atrovent or your ipratropium. So if one or the other does not help you, that's when they're going to open both the doors to kind of hit both those receptor sites and give both of the relief that you need. Those are when you see a combination of your rescue bronchodilator. So that would be your Combivent or your Duonev. So those have two medications in them, and they're both acting with different receptor sites to give you the maximum amount of relief that you need. So it's kind of like you're sitting on that couch letting air come in from both doors versus just one. But some people they can tolerate just the one medication as well, and you might not need the combination of both of the receptor sites in the one medication, if that makes sense. So our next class of medicines are the long-acting bronchodilators. So they are still touching the same receptor sites as we just talked about. The main difference is with your long-acting, it's not a rescue medication, it's a maintenance medication. So what that means is it means that you're going to take it every single day and try to take it close to the same times every day. Some of them are prescribed 1 time a day, some of them are prescribed 2 times a day. So make sure that you are following the prescription. It will last in your lungs, in your system, 12 to 24 hours, and that's why it's different medication to medication, whether you take it once or twice a day. You must take these as prescribed for max benefit. So the front door medications are Ceravent, Bravana, Performist. The back door are your Atrovent, your Spiriva, and your Encruz. So the same concept goes to your rescue as it is with your maintenance, but these you are taking every day, and it's hitting the same receptor sites just differently based on if it's a front door or a backdoor medication. So I have listed some side effects for the long-acting bronchodilators. If you feel like you have an irregular heartbeat, a headache, trouble sleeping, you have trembling, maybe some dry mouth, constipation, just any change from normal that is not pleasant, please let your doctor know. Because as you can tell from the respiratory medications at a glance, that chart, there's a lot of different medications in the same class, and they can try to prescribe you a different medication to see if it kind of decreases that side effect. So a combination drug, you can also have a combination just like your rescue inhaler where it has both the front and back door drug in the same medicine. You can have that for your long-acting bronchodilator as well. So a Noro is a good example of a combination long-acting bronchodilator. The next category we're going to talk about is steroids. So instead of splitting the airways open by reducing the smooth muscle inflammation, what you're going to do with steroids is you're going to reduce the inflammation in your lungs. So it's actually going to open it up from the inside. So if you reduce the inflammation in your airways, it's going to automatically kind of make it more open and make the bronchial more dilated. So that's the importance of a steroid. So instead of just relaxing your smooth muscle like the bronchodilator does, the steroid is actually reducing inflammation. So some examples of steroid: Flovent, Pulmicort, Qvar, Asmanex. If you are taking a steroid medication, please make sure that you rinse your mouth out. If you keep the steroid on your tongue, it can cause an infection, a fungal infection called thrush. And I have not had this, but I have taken care of many patients in the hospital that have, and it is very painful. So please just make sure you are swishing your mouth out and spitting the solution in the sink, kind of getting that off of your tongue. So some side effects for a steroid is hoarseness, sore mouth, a sore throat, or an unpleasant cough. So if you are feeling any of those, please communicate with your doctor as well, because if you think back to the chart, there's a lot of different medications in the steroid class that they can try. So with steroids, you can also have combination medications. So with a steroid, it's taking your bronchodilator, all the medications we just talked about, and it's putting it in the same device with a steroid. So instead of having to take two separate medicines, a bronchodilator and a steroid, you only have to have one inhaler that has both of them in the medication. Now, even if it is a combined medication of a bronchodilator and a steroid, you still need to rinse your mouth out because it still has a steroid in them. So Advair, Symbicort, Dulera, Brio, Trilogy. So with your Trilogy, instead of just having two combination drugs, you're going to have three. It has three medications in them. So with the Trilogy, it has a steroid, a front door, and a back door bronchodilator all within it. So you're only taking one inhaler instead of two. So what I want you to know is at this point, I normally get a lot of questions, and some of them are, well, why do I take Advair and Spiriva? Why am I taking two different medications when my Advair has a bronchodilator and a steroid in it, and my Spiriva also has a bronchodilator? So what I want you to do is think back to the bronchodilator section, and if you notice, your Advair, it has a front door bronchodilator and a steroid in that medication, whereas the Spiriva is the back door. So you might be the person sitting on the couch needing both the medications from both front door and back door to give you the full benefit that you need, and your doctor will be able to decide that for you. So some different things you need to know about your inhalers is a spacer might be prescribed with an inhaler, and we're going to go over kind of what kind of inhaler you need in order to use a spacer properly with that. If you're using more than one puff for a dose, please wait a couple seconds before you take your second dose. I'm going to show you with my rescue inhaler without the spacer. A lot of people will shake it up, put it in their mouth and go 1, 2, and then take a deep inhale in. That is not the right way to do it. And we want you to take a couple seconds to rest in between each puff. So we want you to do one puff, take a deep breath in, hold it, relax, then take your other puff to make the two puffs. So don't take them back to back. Know how to properly store your inhaler. Please keep the inhaler with you at all times. I've made the mistake of putting my inhaler in the car in the winter, and when I was driving to work and my chest felt tight, I went to take my inhaler and nothing came out because it was below freezing outside. So please properly store your inhalers. Don't make the same mistake as I have. Use only the amount your doctor tells you to use, and do not stop using your inhaler unless you've talked to your doctor first. If it's because of cost, if it's because of a side effect, communicate those with your doctor or with us, and we can point you to the right direction because we want you to be able to take medication that's going to help you. So now we're going to talk about some different types of devices that might be prescribed to you. So if you're looking at this slide, you're probably thinking, oh, I have this. If you have Advair, it's going to be the discus. So it's going to be the purple disc. Some of the Advairs do come in an MDI as well as the Symbicorts. So what I want you to see is that an MDI is the only delivery device that you can use with a spacer, and that's why over to the side it says MDI with spacer. So the reason for that is because some other delivery devices might stick to the side of a spacer and it's not going to give you the medication that you need at that moment. So only use a meter dose inhaler with your spacer. So that's all your rescue inhalers and anything that looks like this MDI device. If you have any questions whether you can use your medicines with a spacer, please ask us and we will let you know. So speaking of a spacer, if you have not seen a spacer before, I have one in front of me that I'm going to go over and teach you exactly how to use. So I'm going to kind of slide back so you can see me a little better. So this is a spacer device. Your MDI, I'm going to shake mine up. It goes in one way, okay, and then the other side is your mouthpiece. So the method behind a spacer is it's really hard to coordinate giving yourself a puff, breathing in the right speed, making sure it doesn't hit your teeth or your tongue, because if you can taste your medication, you're not getting all of it. So the spacer, when you release a dose into the spacer, it's going to hold it in this chamber until you initiate the breath, which I really like because it takes a lot of the confusion of coordinating it out of the equation. So as you see, step one, we're going to shake the inhaler and we're going to remove the cap. Step 2, we're going to place the inhaler into the spacer. And then we're going to remove the spacer's cap. Step 3, you're going to hold the inhaler upright with the mouthpiece facing you. So like this. Step 4, you're going to breathe all the way out. Step 5, place a spacer in your mouth and press down on the inhaler one time. And then you're going to take, in step 6, the slow, deep breath. So I'm going to show you the wrong way to do your slow, deep breath first, because I want you to hear what it's talking about in step 6 when it talks about a whistle. So I already shook my inhaler, put it in the proper position. I'm going to give one puff. So the whistle that you heard means that my breath in was way too fast. So I'm going to do another one. I'm going to do one puff. I'm going to hold it. I'm going to blow all my air back out. So as you saw with the proper inhaling of the medication, there is no whistle. And I like that too about a spacer, is because it kind of lets you know that you are taking a good breath in and getting the maximum dose of your medicine. So the step 7, I just did it. You're going to hold for a count of 5 to 10 seconds so the medicine can settle into your lungs. And then we want you to wait about a minute before you take the next dose if you're taking both doses at the same time, okay? Now I'm going to kind of go over how to clean your spacer. So we do want you to clean the spacer because your mouth is on it. You know, you just want to give it a good clean. You don't want anything to build up inside of it. And please know that if you throw this in your purse, okay, because I do this. If you throw this in your purse and you go to pick it back up, the part that you put your inhaler in is open. So just be careful, look around, make sure there's no coins, anything inside the spacer that could harm you when you take your deep breath in. If you want to, go ahead and just store it like this. It closes it to where nothing can get inside of it, okay? So we're going to go over how to clean it. So there's a rubber end on your spacer. You're going to remove the rubber end. It pops off very easy. And you're going to put it into the sink with some soap and water. You're going to swish it around, gently move it back and forth. Then you're going to take it out of the soapy water, rinse it off, and I want it to air dry, okay? I do not want you to clean the inside of this with a towel, a paper towel, anything. I want it to air dry. Because if you think about it, if you clean it with a towel or something that can kind of leave some lint or any kind of irritant, if it's inside there, when you take a good breath in, it's going to get into your lungs and irritate your lungs. So please let this air dry. Step 6, when it is completely dry, you can kind of take the rubber part, it only fits on one way, and snap it back onto the spacer, and then you put it away until you're ready to use it. I do realize that if you're out and about, a lot of people just put their rescue inhaler in their pocket. I get that. That is fine. But if you're home, really try to use that spacer if you are feeling short of breath. And like I said, there are some maintenance medicines that you can use with your spacer as well. We have handouts if you use a nebulizer, so the pipe with the nebulizing tube that has the mist. If you are taking your medicine with a nebulizer, we do have some handouts on how to clean those as well. And please, if you have CPAP machines, humidifiers, anything in your house respiratory related, please make sure you're cleaning it out at least weekly. You don't want any bacteria to build up in there, especially if you have a water chamber. Change out the water. I change mine out nightly, and I clean mine about twice a week with vinegar and water. If you are using a vinegar water based solution to clean your CPAP, humidifier, or nebulizer, make sure that the solution is 3 cups of water to 1 cup of white vinegar. You can also use white vinegar to clean anything in your home. It's very easy when you breathe it in, and it cleans a lot of nasty bacteria, viruses, and mold. If you have any questions at this time, please write them down, bring them to class with you, and ask your coordinator. You will be paired up with a coordinator when you start pulmonary rehab. You will go over all your medications with them. They will be able to answer your questions. But if you have any questions at any time, please write them down, bring them in with you, and we will love to go over those questions because we want you to be as compliant as possible and understand the importance of why you are taking your respiratory medications.